Welcome, this is a little video, I call it Medicare 101. It's important to understand Medicare at a high level so that you can then dive into the details of every individual and circumstances. So we'll jump into it. The first part of Medicare is Medicare Part A. And on Medicare A, it says on the card, hospital coverage. When I was 16 years old, I got my first paycheck. And on my paycheck, I saw FICA, and they took my money. I thought, who is FICA? You've never met a tighter 16-year-old than this guy. Part A is paid for as long as you've worked 40 quarters in the United States or your spouse has worked 40 quarters. Once you turn 65, that is available to you at no cost because of the years you've worked. Part B, on the other hand, is the medical insurance. Right now in the year 2020, that costs $144.60, and that will always come out of your Social Security check. If you're not taking Social Security yet, the government will bill you for this, typically on a quarterly basis. I get a lot of phone calls, panicked people, why did I get this bill for over $400? Well, it's 3 months worth of this premium. Now, if your income exceeds certain levels, you may pay more for Part B, but for the general population, $144.60 is the cost currently. I still meet people to this day that only have a Medicare card. If that's all you've got, you're one illness away from bankruptcy. It will cover about 80% of your expenses. However, there's no cap on the other 20%. So I've seen multiple bills that have exceeded $500,000, upwards of $1 million. And if you only have Medicare, you've got a lot of exposure. So people will purchase what's known as Medicare supplements or Medigap plans. Those will fill in the gaps of Medicare. There's deductibles here and so forth. I'm not diving into the details. This is high level. But a supplement will pay the other 20%. And there's many letters, A, B, C, D. Plan G is currently the most common. It's important to note if you buy a Plan G, it doesn't matter what company you buy it from. It's the exact same coverage. So you name the company, AARP, Conseco, United of Omaha, Mutual of Omaha, Blue Cross Blue Shield. A G plan is the same on every company. Prices and company reputation may vary. So think of Medicare as having two options or ways to access your benefits. The first option is what I just explained to you as a supplement. If you choose this path, you will have one insurance card that you show the doctor. That's your A and B card. You'll have a second card, which will be your supplement card. You'll have a third card. Any guesses what it is? That's right, it's a prescription drug plan, Medicare Part D, which costs an additional premium. The average right now is around $32. That's one way to access your Medicare benefits. The second option or way to access your benefits is known as a Medicare Advantage Plan. An Advantage Plan works differently than a supplement in the sense that the federal government has basically outsourced your health insurance or contracted with a private company. Advantage. If you choose this direction, the federal government sends funds, and it is substantial funding, that they'll send to a private company to then administer your health insurance. These plans are known as Advantage plans, otherwise known as Medicare C. Most people think it's D for drugs. It's actually D because there is a C. One of my favorite jokes. So if you have an Advantage plan, the government's sending those dollars. A private company is now managing your care, And because it's substantial dollars, typically there's a lot of companies that want those federal dollars or want to entice you onto those plans. So you've got big companies like Blue Cross Blue Shield and Aetna and Humana and United Healthcare and several others depending on where you're at in the country. Many of these plans may not charge you anything because remember they're getting the dollars from the federal government. Instead of 3 cards, you would have 1 card that you would show at the doctor's office or the pharmacy. And often they'll provide things like dental, vision, hearing, some nice supplements that original Medicare will not cover. So that's a quick high-level view of Medicare. You could go in and search what these benefits would be in your area where you live with a supplement. I mentioned it doesn't matter what company, it's the exact same coverage like on a G plan, where the Advantage plans are all competing for your business. So depending on where you're at, they'll put together a package that may be more or less competitive than another company. I hope you found this very educational, that you've understood the 2 different options or pathways of Medicare, and that you've understood the differences between A, B, C, and D and the way to access benefits.